Okay, so we're going to do a segment on why my vitamin D doesn't go up. Okay, so virtually everybody who comes in here has low vitamin D. Vitamin D it does a lot of things, but in my world, the things that the aspect of vitamin D that's most important is that it helps to control the immune response, and along with glutathione, vitamin D and glutathione help something called the regulatory system of your immune system. So the regulatory system is this. Something comes into your system, like a virus or a bacteria, and your immune system goes, kill it. And so your immune system sends out certain white blood cells, and they beat it up, and they stab it, and they choke it, and they kick it, and they do everything they can until they can kill that virus or bacteria. At some point, somebody's got to tell that immune system to stop. It's over. It's okay. It's dead. You're done. Okay, and that's the regulatory system. That regulatory system, the fuel for those cells that run the regulatory system is vitamin D and glutathione. Okay, and why is that important? Beyond that, because if they're not weak, if they're low, that regulatory system is going to be weak, and then that viral infection may keep going on and on and on, and it may end up attacking your tissue and starting an autoimmune problem. But if you have an autoimmune problem, that regulatory system also takes the next step and is trying to get your immune system to stop attacking, in the case of Hashimoto's, your thyroid, or in the case of rheumatoid arthritis, your joint tissue. So vitamin D and glutathione are huge in autoimmunity, okay? And so vitamin D, everybody comes in here, I mean, 95% of people coming here to vitamin D is like less than 30. The range is 30 to 100. In other parts of the world, it's higher. But most of my patients are either in the low 30s or in the 20s or even into the teens. So that means that your vitamin D is extremely low, and it seems like most people are getting on board with this now. People come in with low vitamin D, they might say, oh, I'm already taking 50,000 units a week with my doctor. Depending on the severity of it, I mean, I might dose anybody from like 10,000 to 50,000 units until it gets up to the point where it should be. And people go into shock if I say 50,000 units, and their doctors are going, you're crazy. But here's the problem. There's an awful lot of reasons that your vitamin D won't go up. A lot of them can have to do with the things that are causing you problems in the first place, that are causing your immune system to be out of control. A lot of you come in and you'll have small intestinal bacterial overgrowth. Small intestinal bacterial overgrowth will overwhelm your system. It'll cause your gallbladder to not be able to work right, and you won't break down the vitamin D. It can overwhelm your liver eventually, and the liver's not processing vitamin D. So there's a lot of reasons why people come in and they go, I'm taking 10,000 units, 50,000, and it's still low. Okay, so the SIBO is one of them. Small intestinal bacterial overgrowth would be one of them, but in more of an order, from a physiological perspective, most of my patients come in here have digestive bowel issues. A lot of people have food sensitivities. A lot of them have problems where they just have a broken down digestive system. It's not working. If your gallbladder is not working properly, and it's not breaking down the vitamin D, and you have leaky gut, and it's not going to absorb it as well, and it gets into your liver, and your liver's slowed down because you have a thyroid problem, which is slowing it down and slowing down the ability of it to do its job, you're not going to process your vitamin D. If you have small intestinal bacterial overgrowth, that's affecting your gallbladder. It's also helping perpetuate a leaky gut. That's also affecting your liver. You're not going to be able to process vitamin D. So those are some of the more physiological abnormalities that'll cause you to not process it. Just inflammation alone. Inflammation alone will, if you have aggressive inflammation, inflammatory responses can affect all of these things, and the inflammation can cause you to to not be able to process your vitamin D properly. If all of those things are getting better and the person is not properly processing their vitamin D, then you want to start looking for what are called genetic polymorphisms. So basically what that means is your vitamin D has to be broken down. Well, that's gallbladder, that's liver. It has to be absorbed, that's intestines, but it has to then get into the cells. And so what happens is there can be these genetic imbalances called polymorphisms, and it can be in the receptor site where the vitamin D is supposed to actually get into the cell, and the receptor site may not work properly. It may not open to let the vitamin D come in. That's a genetic thing. These people are going to need to take a lot more vitamin D. It could be the binding protein. So vitamin D is like a hormone. Okay, a lot of people don't realize that it's actually a steroid at the right dosages, and all hormones need a protein to carry it around to get to where it's supposed to be. So this genetic polymorphic could be in the binding protein that carries you eat the vitamin D, it goes through that whole process, gallbladder, liver, gets into the bloodstream, and then it's got to get to your target tissue. It's got to get to where it needs to go, and so that taxi cab that it gets into, and that protein that takes it to the cell, that may not be working right. That can be a polymorphism, and the way you address this is you have to figure out if it's that or not. So there's another test that most people don't do, and it's called a 125-OHD. Now I'm not going to get into it how it's different from the blood test that most of you take, but the deal is if you do it and it's high, then mostly it's going to be inflammation. It's going to be one of these other things. It's going to be an inflammatory response. It's going to be the gallbladder not working. But most of the time, it's going to be like inflammation. If it's normal, it's going to be gallbladder inflammation, and if it's really low, it's going to be the genetic polymorphism. So then you would have your doctors run that, and then it would allow them to know, okay, you're not absorbing your vitamin D, so let's fix all of this first and see if the liver or gallbladder starts working, the intestines start working, the leaky gut goes away, the SIBO goes away. Now your vitamin D just starts going up. Some people you could even say who are taking it and it's not going up, and they have all that. You could even say, look, let's just wait on the vitamin D. Let's take care of all that, and let's see if it's coming up with the doses that you have. The genetic polymorphism, you may want to start dosing higher to see at what dose that they actually, what dose does it actually do somewhat of its job, and particularly in getting to that regulatory system for those of you who have autoimmunity. So at that point, much higher doses of vitamin D might be appropriate. Now, your medical doctor's not going to agree with this, but your medical doctor really doesn't really take any of this into consideration when they're looking at it. It's just like your vitamin D is too high, oh my God, it's a problem, and they don't look at really why they think it's too high, and maybe your vitamin D is up to 100, 125. Maybe that's okay for you. Maybe that's okay for you if you have these polymorphisms and you have to shove enough vitamin D. And let me just say, vitamin D, in my patient population, it's really not about not getting out into the sun enough. Fine, you can get out in the sun enough, I get it. Okay, but that's not what it's all about. I have lifeguards coming in here who are out in the sun all day and their vitamin D is 10. So, I mean, that's not usually a factor by the time a patient gets to me. So if you're a patient who has like full-blown Hashimoto's and you have gut problems and you have SIBO and you have leaky gut and you have food sensitivities and you have chemicals, the sun's not the issue. Okay, it's usually all these other things. So that's why your vitamin D doesn't go up even though you're taking 10,000 units a day or a 50,000 unit shot a week.